get cold.
It's cold.
Yeah.
That's right.
All right, so everyone has the package, and the package, it is a sensory is the section. These are from exam tempo. Very good, very simple, but we must know some disorders on the sensory system. So if you move on page number 2 is on that, move the first page, and let's go directly on the cataract. It says the cataract. We all should know what would you do care for your patient with cataract. What is cataract? In the first line, opacity of the lens. What is cataract? Opacity of the lens. The lens is opaque. Second line, very common cataract are aging, older patients are. And third line, underline the word steroids. Lot of time when patients are taking steroids can lead to. So first thing we all should know what is cataract, opacity of the lens. The lens is more opaque. Problem in the lens. Very common, second line aging, third line in the beginning the steroids. And that is important. Now very important that cataract patient you will see a lot of older population. And you're dealing with older person. In the next underneath it says infant, where it says the word cautious, I want you to remember in the children when the child is 3 months of age, they follow moving object. If the child is not following and unable to do, you must see ophthalmologist. That means there's something wrong with the vision. What are the symptoms of cataract are? Very important, blurry vision. And second one is important, glare. You start feeling glare when you go out in the bright light. So what is it? There is a blurry vision, but you feel glare when you are in the bright light. And next page, if you move on, gradual loss of vision. So what is cataract are? Gradual loss of vision. And what does the patient see? It's very glare when they're going out in the sun. Now, very important, let's move on. They have to do the surgery. And in the next box, you will go, surgery would be done. In the second box, the line is medication. What medication? I want you to highlight the word Diamox. D-I-M-A-X. And I will be talking this medication again in cataract. So Diamox can be given. Why? Is to reduce the pressure. So this drug is also used for glaucoma. So what are they putting when patient is going for surgery? Diamox. Why? To reduce the pressure. If you move on the page number, it says 117 on the top, and in the box it says cataract surgery. What drugs are used during surgery? Number 1, Diamox. Number 2, third line, mydriatics. Everyone should know what is mydriatic word? Dilating. And what do they use for dilating here? Neosporin. Highlight that word. So they're giving Diamox and also mydriatic drops such as Neosporin, and underline the word next line, cycloplegic. Everyone should know in eye drop what is cycloplegic are. Your medication name is Cyclogel. Underline the word name of medication, Cyclogel. Why do you use cycloplegic? Underline the word paralyzing the muscle. So what is cycloplegic medication are? Paralyzing the muscle. So you want to, everyone should know the word mydriatic, cycloplegic, and cyclogel is done. Now in the last 2 lines, in the same paragraph, it says the word Versed at the end. After the client is in the operation room, they give Versed. Why do they give Versed? To lower anxiety level. What do you monitor when you give Versed? I want you to write down the word respiration. So Versed is in the last 2 lines, in the same paragraph, you say at the end, it says IV injection of Versed can be given to induce anesthesia and local anesthesia. And what do you monitor when you give Versed are the respiration and the blood pressure. When they remove the lens, next paragraph is called ECCE. What is ECCE? Extra capsule cataract extraction. Name of surgery. They're removing the capsule. Now what do you monitor after the surgery? Let's go in the last two lines. They're implanting lens and patient would need antibiotic. In the last two lines, steroids and eye patch and shield. After surgery, what drug can be given are steroids, antibiotic, and eye shield. Everyone is okay? Cycloplegic medication word is very important. Medication you are giving to the patient are antibiotic, and patient may be taking a steroids and eye patch. Page number 117. In this pages, and make sure go on page 117. And I'm talking about cataract, and we already finished two paragraph. Post-op care. Patient come back after surgery and underline the word semi-Fowler's position. Second line, patient is going home in 2 to 3 hours. So remember, they're not staying too long, and they're older patient. I want you to write down on the side, ambulation. Safety is important. If they give you a question, what do you do patient who has cataract and immediately after surgery? Safety. They're older patient, they cannot see well, and they're not staying after surgery more than 2 to 3 hours. Now the last thing, you will go on cataract, page 117, to avoid activities. What are you avoiding activities? Highlight the word bending. Avoid bending. And blowing nose, tight t-shirt, closing eyes tightly. Place the head in dependent position, resting on the side. To report patient pain. If patient develop any eye pain, headache, you need to notify. Bleeding, any sign of bleeding, next line, notify. Report any flashes, floaters, need to notify. The best is avoid shower. What do you give them? Is the tub bath. Avoid that. Next line, eye medication. Whatever the doctor has given them, an eye shield. Everyone should know cataract patient, they don't stay in the hospital too long. What do you give them? Eye shield, eye drops, follow-up appointment, and any pain they need to notify. I'm going to move on same page, glaucoma. What is glaucoma is? Underline the word intraocular pressure. Increasing what? Pressure in the eye. There are two kinds of glaucoma. Here we have primary glaucoma, or when they use the word open angle glaucoma. What is the meaning here? In both eyes, second line, most common, it's a asymptomatic. Asymptomatic, no complaint, and decreasing in outflow of aqueous humor. We all should know what the fluid in the eye we have, aqueous humor. There are another fluid, vitreous, which is in the back. But what is in the anterior chamber of the eye, we have aqueous humor. And what happened in aqueous humor is decreasing outflow and is caused by, what is the reason for open angle glaucoma? The aqueous humor are not draining out and increasing the pressure. And the pressure goes above or between 22 to 32 mm. So underline the word, the eye pressure goes high, more than 22. Less than 22, up till 22 is normal. Are we clear? More than 22 and 30 above, the pressure goes high and is called. So remember, what is primary open angle glaucoma? Two things important here, asymptomatic and decreasing the outflow. And the pressure in the eyes is high. Next page, we'll move on. What are the main symptoms of glaucoma? Number 2 is diminished peripheral vision. What is the vision is affected? Peripheral vision. Then the last line, if you will go, increasing the pressure. Now very important are number 2, is diminished peripheral vision, and the last one, the pressure is high. Are we clear? Next is acute glaucoma question. What is acute glaucoma? It is called narrow angle glaucoma. So what is acute glaucoma, narrow angle glaucoma? Second line. Very important, sudden increase. It's all of a sudden it comes. Acute glaucoma comes sudden. In your question, sudden increase in the aqueous humor. Too much, all of a sudden the pressure goes high. And line 3, patient complain severe pain. Your question, patient has acute severe pain in the eye, is your acute glaucoma. What is it? Third line, emergency. And what do we do is the pressure would go more than 30 and loss of vision. So what can happen? Write down the word blindness. It can lead to blindness, loss of vision. So we must treat them right away. So what is acute glaucoma? Everyone remember, read your question, severe pain, all of a sudden. Pressure goes high, patient complains pain, that's acute glaucoma. Second thing, sudden pain, excruciating pain. Number 2, patient complains severe eye pain or severe headache. Next is nausea and vomiting. And the last one, pupil dilation. So anywhere acute pain, headache, nausea and vomiting. Secondary glaucoma is related to ocular condition such as canal of Schirm. There is in the eye, canal of Schirm, involved production and circulation of the fluid. That's is in the structure in the eye and producing. One was stopping the flow. Secondary glaucoma means canal of Schirm producing more fluid. Are we clear? So, and what is a normal ocular pressure is 10 to 21. More than 22 above is glaucoma. What is glaucoma is acute, all of a sudden. What is glaucoma leading into is the blindness. Are we clear? Must be treated immediately. Now I'm going to highlight the wording medication. We all must know the drug. Next we go management of glaucoma. What is the management of glaucoma? We have second line. Remember the name of medications are miotics. What drug do we give for glaucoma patients are miotic. Highlight the word are carpin, iseptocarpin, pilocarpin. We must know the medication. And what do miotic does? Underline the word constrict the pupil. So what is miotic are? Constricting the pupil. Are we clear? And what drug are we giving here is pilocarpin. And what does it do? It increasing the flow of aqueous humor. The fluid is not draining. Now what does it do? Increasing the flow of the fluid. Next eye drops are beta blockers, which is called Timoptic and Timolol. Whenever you are giving beta blocker, I want you to write down on the side, check the pulse, because it lowers the pulse rate. So beta blockers, when we are checking, when we are giving eye drops, check the pulse rate, lowering the fluid. So second one is your beta blockers. What are the second name of the eye drops are? Timolol or Timoptic. Third medication are Diamox. Remember, we talked about Diamox earlier, and I said I will be talking about that next. Diamox is given to decrease the production of aqueous humor. Highlight that word. And third one is osmitrol, which is called osmotic diuretics, and underline the word mannitol. Everyone, these four drugs we got to memorize for our exam. What are the drugs are? Iseptocarpin, pilocarpin, then I said timolol is beta blocker, then I said Diamox and mannitol. And I highlight mannitol and Diamox, write down on the side, you monitor, they lose potassium. They're diuretic, so I want you at the end, what are you monitor? Potassium. For which one? For mannitol. And mannitol is given for which patient? I write down on the side with mannitol when you have acute glaucoma. You're giving IV. Are we clear? So mannitol can be given IV to relieve the acute attack. Second box, we will go, surgery would be done to control in open angle glaucoma. And what surgery would be done? Underline, second line, laser. So the main treatment for glaucoma is your medication. What are we preventing patient here? For blindness. Are we clear? Next page, if we move on, they will do on the first box, page 119, in the last line, laser surgery. They can do laser surgery. And what do you do after the procedure, post-op care? In the first line, non-operative side. What side patient can turn non-operative side? Avoid taking any blood thinners like aspirin. Second line, if there is a pain, they need to notify. Any vision problem, decreasing vision, any kind of acute pain patient is having, need to notify, could be sign of bleeding. In the next box, I want you guys highlight the word, a patient has glaucoma, no over-counter medication. Such as in that box, it says in cautious, Visine. Why? Because it causes rebound vasodilation and raise the pressure. So don't buy over-the-counter medication such as Visine. Why? Because it will cause rebound vasodilation and causing the pressure in the eye. Next box, atropine. What is atropine? Are mydriatics. It dilates. You never use atropine. So in your NCLEX exam, they're asking you which medication you question the doctor. So in your order, if you have a glaucoma patient and they have atropine, you're not going to use it. What medication do we use for glaucoma? Miotics. What we cannot use? Atropine. What is atropine is? Mydriatics. Okay? Now retinal disorder. In the eyes, retina is the inner layer in the eye. And which are the patient can damage retina? I want you to highlight two simple words. Second line, hypertension. Second word, diabetic patient. And macular degeneration word. So what is patient who have, number one, hypertension? Eyes are damaging. Patients are diabetic, they're going in retinal damage. And next word is called macular degeneration. Hypertensive means patient who are having hypertension. What does it cause? Go in the third line. If the blood pressure remains high, elevated, arterioles become occluded and they form soft exudate and cotton wool spot. So they call cotton wool spot. Or systemic hypertension can cause last line, retinal detachment and loss of vision. If you can remember all of them, in number one, hypertension damages what? Eyes. And what does it damages? Retina. Because retina, the inner layer, and what happens when your blood pressure is high, those blood vessels start bleeding and they can cause rupture. Next is diabetic patient. And what happened to diabetic patient? Same problem. Underline the word vascular changes. When the blood sugar are high and go in the next line, it causes background diabetic retinopathy, and that means microaneurysm and hemorrhage. Everyone just remember two simple words. Retinal changes takes place when you're diabetic and you have high blood pressure, and it causes microaneurysm. And they can also cause retinopathy. That means the blood vessels are developing and leading into the leakage of the protein. That means it's affecting the vision. Everyone is okay, blood pressure and diabetic. Next page, what do they have to do is on them are laser surgery. They can do the laser surgery. Now what is macular degeneration word? Macular degeneration affect eye into, underline the word, central vision. Macular degeneration takes place and central vision are affected. There are, number one is atrophic or dry. Now in that one, underline the word, retinal capillaries are sclerosing. That means the blood vessels, and they're losing. Remember, in the eyes, there are rod and cones inside the eyes, and they are affecting. What is this dry one is? Affecting red and cones in the eye. Why? Because retinal capillaries are losing those cones. And which are the high patients are like smokers. And also the diet. In the next line, if you will go the last one, antioxidant in the diet and lutein and carotenoids are good for the eye, and if you're lacking, it can lead to is the damaging of the retina, which is called macular degeneration. The wet one is also a serious detachment, underline the word, of pigmented macula. Macula is in the eye. So red rod and cones and serious detachment of macula. Underline that word, that is there. Treatment is slowing the process, and laser therapy would be done. Now, so remember, retinal damage are there for three problems. Number one, for hypertension, diabetic, and maybe patient has retinal degeneration, means is central vision is lost. Are we clear? Rod and cones and macula void. If you remember, that's affected and patient cannot see. Retinal detachment. The meaning is detachment. The retina is moved away. And detach, how? Underline the word, is blow to the head. Hit the head hard, blow to the head, one of the reason. Second reason, aging process. So what are the two reasons for retinal detachment? Your question would be blow. And second one is aging. And is pain-free. Underline the word, there's no pain, pain-free. And what would the patient would complain? Patient would say blurry vision. Number one, they cannot see clear. Then you go, is the flashes. They're feeling the flashes of light. Floaters in the eye. Third one, veil. Veil means sometimes they use the word like a curtain. Something is falling in front of their eyes. So what are the signs of retinal detachment? Are blurry vision. Number two, maybe a flashes, floaters, and veil. Are we clear? And remember, there is no pain, pain-free. What do you do when your patient comes with retinal detachment? Everyone should know these 3-4 things I'm talking, and very simple way. We got to know the patient if you're dealing with these conditions. Number one, place the patient in management. It says in area of dependent position, and write down bed rest. Number one, what do you do? Bed rest. Patient should not be walking around because detachment is going to get worse. So first thing, what do you do as a nurse? Bed rest, call light, tell the patient don't get up, turn the patient on dependent position. And then what do you do? Line 3, sedatives, you can give them. And anti-anxiety medication. And the last one, surgical management they can do. Now you can also give them eye patch or padding to cover the eye so they can rest. They won't use that eye. Next is bed rest is important, dependent position, sedative, anxiety. And next is surgical treatment. In the second line, what is the treatment is called is second line scleral buckling. So the treatment is called scleral buckling. Next page, we will move on, post-op care. Patient come back after post-op care, scleral buckling, underline the word, they're using gas or oil to keep the sclera in place. Second line, position on abdomen and turn the head so the operative eye is upward. So patient is laying how? On the stomach, prone position. If they have repaired the right eye, what do you do? The right eye, turn the eye up. Don't lay on the right eye down. So on their stomach, and affected eye should be upward. Are we clear? So that is important, your position. Third line, and how long? For several days, until the oil and gas has been absorbed. Position, a patient is sitting in the next line. Sit on the bedside and place the head over the bed table. They can sit, but they should use the table and resting on the table, on the over bed table. Bathroom privilege. Patient can walk, but head should be bowed downward. Are we clear? So if they're going to the bathroom, they got to keep their head a little lower because you don't want to create the pressure. So few things we must know. Bathroom privilege is okay, bedside sitting is okay. The surgery is done. There's nothing we can do for retinal detachment. They have to go for putting back the retina in place. And what do you do after the surgery next? Monitor for pain and nausea. Report if there is a pain and nausea. Avoid reading and writing. First post-op week. First week, no reading and writing. Do not bend over so the head is in the dependent position. Be careful not to bump the head. Don't bump the head. Those are also you can add in the teaching. Now the next wording, it says in refraction, myopia word. Very important. What is myopia? We all should know because these wording are coming in the exam. Is myopia nearsighted? What is the meaning nearsighted? Highlight the word image. Whatever the picture is coming in front of retina, rather on retina. Highlight the word in front. So where is the picture is focusing? In front of retina. Where should it really focus? On retina. So where is focusing? In front. You must know. And they will correct it by using the lens in the second line, concave lens. If you don't know, that's okay. But you must know they got to use the lenses. And what is myopia word? Nearsighted. Whereas the picture is focusing in front of retina. That's important. Number 2, far-sighted. And where does it opening picture is? Behind the retina. Focusing behind rather than the on the retina. Presbyopia word is lens loses elasticity and is very common in the last line in the older patient. So presbyopia is a vision problem. And why? Because the lens, they're losing elasticity and more in older patient. What is astigmatism? Is uneven curvature of the cornea causing the light rays to reflect, so the focus point on the retina is not achieved. So uneven curvature of the lenses. Now, these are important on this page to know the word myopia, hypermyopia, astigmatism. Next page, we'll move on, is traumatic injury. I want to highlight the main wording here, hyphemia. Patient is admitted with hyphemia, means is the bleeding. What is the meaning? Hyphemia, hemorrhage. Whereas the patient is having hemorrhage, bleeding, anterior chamber, underline the word. What do you do if your patient is admitted and they give the word hyphemia? Second line, bed rest. Position, semifowlers. No sudden eye movement. What drug do you give to rest the eye? Cyclopg. Eye patch is good, eye shield is good, and limit the TB is there. So everyone is okay. What is hyphemia? Bleeding. What do you do? Bed rest answer, Fowler's position, cycloplegic, eye shield. Contusion means is bruising in the eye. What do you do in the treatment in contusion? Highlight the word ice. Apply the ice. And very important, contusion means is bruising, eyes should be examined. And elevating the client head 30 to 45 degrees to prevent edema. So everyone, contusion, eyes, elevation is good answer for edema and swelling. Foreign body is in the eye, irritating or abrading. Whenever there is something in the eye and abraded and embedded, that means it's going in and is deeper. What do you do, patient? Underline the word ER. Patient should go in the emergency. Cupped object. What is cut? Like a cup shape? Or maybe loose. Don't tape it very tight. Maybe if you don't have cup and it says covered loosely, that means don't apply the pressure. So don't apply the pressure, but cupped is a good thing. And what drug do you use? Very important to see the object is called fluorescein for irrigation. The last line everyone should know, to see the object in the eye and you are helping the doctor. What would you give? I gave you guys question and you will do the question and that may be one of the question. What do you give the doctor when to look for the foreign body? Your answer is fluorescein. And followed by irrigation with normal saline. Now, remember, for your eyes irrigation, if there is a chemical or something, water is very best, okay? Normal saline is okay after the doctor has done his irrigation. You don't know some chemicals in eye, don't take normal saline, go more for the water. Water is the best to wash the eye. Next is laceration and penetrating injuries are corneal laceration is an emergency, and last line, they must be given IV antibiotic and surgery. In the next box, all your eyes must be examined. Underline the word cautious, ophthalmologist. Ophthalmologist is the one who can look the eyes inside. So eyes should be examined by who? Ophthalmologist. Next is in the visual on the next page. I want you to highlight the word, few things here. Snell chart, second line. Why do we use the Snell chart? Underline the word visual acuity. You are checking the vision. How far do we stand? 20 feet. Then you go Ishriya chart. What are you looking in Ishriya? Color vision, looking the color. Highlight that word. Next is you will go in the Ansler, skip 2 line, and every 6-month exam should be done. Then you go Ansler grid. Ansler grid is the test for macular degeneration. Then tonometer, highlight the word, for intraocular pressure with glaucoma. So how do you check glaucoma? By tonometer. How do you check macular degeneration? By Ansler grid test, okay? Now I will move on the next page. On the next page is otitis. I'm talking about ear. And what is in otitis means the ear, externa means outside. So when patient has otitis externa, underline the word, it is also called swimmer ear. Underline the word. So skip that page. Now go to the next one, and that is the word says otitis is externa means swimmer ear. So if there you see what is swimmer ear? Infection of the outside of the ear, external, outside. And when is it common ear infection? Hot weather, humid weather. Second line, allergies and external otitis media. Third line, hairspray, cosmetic, earring, earphone, hearing aid. Anything outside we're using and is infected can lead to infection. So any kind of hairspray, cosmetic, earring can cause infection. But it can occur is from bacterial infection. Underline the word. Most common infection is called Pseudomonas. And Staphylococcus and Streptococcus. Pseudomonas, Staphylococcus, Streptococcus infection. Then I want you to highlight the word last line in the same part. What does it cause infection to the brain and leading to meningitis and leading, last line in the same paragraph, cranial nerve. So a patient has outside infection, what infection can lead to complication? Meningitis. Brain abscess, cranial nerves can be damaged. So that means should be treated by antibiotics. Otitis media is middle ear infection. I want you to write down middle ear infection, highlight is in the middle, more common in children. Why? Second line, because the tube, eustachian tubes are shorter, wider than in the adult. What is the common cause of otitis media? H. influenza. Underline that word, H. influenza. What does the child feel? Pain. They have a lot of pain in middle ear infection, fever, vomiting, anorexia. Those are very important. Fever is important, pain is very important. And what do you, it happens if the pressure goes high, it can cause tympanic membrane to rupture. And when membrane rupture, it can lead to pain subside, lower the pain and fever. But it can cause scarring. Highlight the word is hearing loss. What do you monitor after otitis media? I want you the complication. I want you to write down loss of hearing and meningitis, second complication, and mastocytitis. Mastocytitis and meningitis. Very important that we know meningitis, mastocytitis, hearing loss. That's why the infection must be treated. Next box you will go is systemic antibiotic. They must be given, systemic means PO medication, antihistamine and decongestant, and how long the antibiotic, 10 days, 7 to 10 days, and they must complete the medication. The last two line is meningeotomy. They can put the tube, and polythene tube or meningeotomy is small surgical incision is made in the tympanic membrane. So what is the surgery is done? Meningeotomy. I want you to write down on the side, if there is a question on meningeotomy, what would you teach patient? Number one, avoid bending of head and bouncing. So remember, avoid bending. When they're drinking, they avoid drinking from the straw, through the straw. Don't use the straw. Number three, avoid traveling in air, plane, because of the pressure. Avoid constipation or straining on bowel movement. Avoid coughing. 1 week, avoid washing the head. That means the water, shower and washing. Blow on one side nose at one time, blowing one side at one time. So keep them is good, and that's important. Next is Meniere disease. Everyone should know what is Meniere. So we talked external ear, middle ear. Meniere disease is inner ear. Highlight the word triad symptom. What is the word triad symptom? They have vertigo, underline. What is vertigo? Dizziness, tinnitus, and loss of the voice. Are we clear? So what do they feel? Number one, very important, vertigo, tinnitus, loss of tones. I want you to add nausea and vomiting. They feel also nausea and vomiting. Now what does it can cause Meniere disease is fluid in the last line, fluid balance. Only highlight the word, main wording. Triad word is important, vertigo, tinnitus, loss of is their voice, and the third one, nausea and vomiting and fluid balance. Let's go to the next page. What happened in the fluid, we'll be talking about what is the management. Antihistamine, antiemetic, and diuretics. On the top, I want you to write down, number one, bed rest. That's number one answer for us. Because why? We are nurses. Patient is dizzy, they're going to fall. And their dizziness is really bad. And they can have a lot of incidents to fall. So what do? Your patient is admitted with Meniere disease, number one, bed rest. Then you will go antihistamine, antiemetic, diuretics. Why? Because they have a lot of fluid in the ear. I want you to underline the word endolymph fluid in the third line. In the third line, there is a word endolymph. So what is Meniere disease? Everyone should know they have a lot of fluid which is called endolymph. What happened? There's a buildup of fluid in the ear. So what is Meniere disease? Now you complete. There's a too much of fluid is endolymph. And what do you want to goal is decreasing the fluid. So how do you decrease the fluid? Highlight the word diuretics. Second line, highlight the word salt and fluid. What do you cut down here? Salt and fluid. And what do we give here? Diuretics. Next line, cessation of smoking. And the next word, I want you nicotinic acid. Now in exam, there's not one question that you will have one answer. All your answers are all that above. About 20, 22 questions you will be answering. Your patient is admitted. What would you do? So not knowing one answer, remember there's a building of the fluid. And they're telling you patient is admitted. What would you do? Number one, bed rest. Number two is don't let them walk. What do you teach them? Cut down salt and water. Diuretics you have. Smoking you have. Nicotinic acid because it causes vasodilator. The next paragraph is surgical treatment. Underline the word laparotomy. Underline that. And after that surgery, hearing in the affected ear is lost. So everyone should know Meniere disease. And even they had surgery, what are they losing? Hearing loss. So your answer is, patient says, I'm going for surgery, my hearing will get better. Patient doesn't know the surgery may not be effective, but they're reducing the fluid. And what is it here? Building up the fluid. Everyone is okay? Meniere disease. This is the way we got to memorize otosclerosis word. Otosclerosis is again inner ear. Underline the word hardening of the stapes, that the word in there, and incapable of movement. So what happened is affecting the stapes and they cannot move. And second line, common cause of conductive hearing loss. So what is otosclerosis? Hearing loss, conductive hearing loss. And where is it affecting? In the stapes. Are we clear? Now we will move on management. What do? Stapedectomy. They do the surgery and it's called stapedectomy. And the diseased stapes is removed and oval window is sealed. So they remove the stapes and they're sealing the window. So you got to remember the name of surgery when patient has otosclerosis. And they put the plastic prosthesis. Now the next line, your question are, patient will have hearing might decrease. Immediately after surgery, what happened? Hearing loss. And patient says, why I'm having hearing loss? Why? Underline the word swelling and fluid, accumulation of fluid, but should improve when blood and fluid are absorbed. So what do you tell the patient is normal? Are we clear? Why? Because of swelling. Are we clear? And because of fluid. But they will be okay. So number one, very important, otosclerosis is stapedectomy. Next is avoid pressure in the ear, blowing the nose. Air traveling, avoid them. And chance of getting upper respiratory infection. In the last line, if the client must cough or sneeze, should do it with mouth open. Okay. Next is report pain and facial sensation. Next is avoid water. How long? For 6 weeks. And avoid getting water for 6 weeks. And antibiotic, antiemetic. I want you to add there, assist ambulation for your patient for 1 to 2 days. And side rails, important. And how long will it take them healing? 6 weeks. So make sure healing takes place 6 weeks. And what do? Keep the side hills up, help the patient to ambulate. What is presbycusis? Hearing problem. Underline the word aging, underline the word sensory neural hearing loss. The key wording, aging and sensory hearing loss. And what does it damage? To the cochlea and inner ear. Could be deficient, and it's mostly in aging, and reason is deficiency of B9 and B12. Sensorial hearing loss may be also related with ototoxic. Ototoxic means the medication damaging the ear. That can also be affected, and loud noise. The last page, I will just show here, trauma. Ear trauma patient has. Patient comes in, pain, infection, hearing loss. Injury to the damage to the inner ear or blow to the ear. An extreme change in pressure. Injury can happen to the tympanic membrane. Children frequently, they like to put things in the foreign body and they get dislodged. Anytime foreign body, take them to the hospital. The last one I have here is standing. When patient has hearing problem, always is stand in front so they can see the lip. Normal tone voice. Avoid background, TV, music, turn it off. And writing using the picture also can be helpful. Low tone voice is important. Now, what are the tests they use for hearing are, remember, I want to write down the word Weber tuning fork for hearing test. How do they examine? Diagnostic, you have in the last line. Diagnostic tests are done Weber and Wright test for bone conduction. So it's a conduction, and they're using Weber test. On the Weber test, when they're doing, they're putting on the middle of the head, in the middle of the head. And when they're using Rhine tuning fork, they put it on the behind the ear on the mastoid process. Are we clear? And these two, if they throw that wording, they're using for hearing test. Okay, we are almost done. The last page, this one, everyone, you guys have drugs. It's all up to you guys how you will remember. A lot of drugs we have done here, a lot of drugs I said. But let's quickly look on page 71. I just want you to highlight Accutane. We already talked about Accutane. And I want you to highlight the word, third one, Lindale Quell. And Lindale and Quell you are using for scabies. In the second box it says. So remember, Quell can be also used for scabies. Then you keep moving here and you have iodine, betadine. Betadine we are using on the skin. RID, R-I-D, RID, we are using for head lysis, pediculosis. Salicylic acid we talked about for scaling. Remember, cherolytic agent. Then you have tetracycline. I talked about that. Tinactin is your fungal medication. Highlight that. So make sure you guys look. And next page, if you or that you can turn, some of you have only one page, is Zovorax, is given for viral infection. And Alpha Cari is your lotion, is for Boros solution. You're using Alpha Cari, second one, and the third one, Boros solution, you're using for, they do not use with occlusive dressing. It's just the solution to wash. Benadryl, we are using for antihistamine. You have, those are Hibiclin. If you leave one, it says Hibiclen. It's a cleanser. Hibiclin is cleanser to wash. Cold Star, I showed you in the picture for psoriasis patient. Steroids are anti-inflammatory. I gave you the name, Lidex cream, Kenalog cream, those are. Now the last one you had in the package is Grofacin, is fungal medication. Remember I said for ringworm and that. So guys, keep this together, and I want you guys practice as much as you can do your question every day. Check the answer with me and study the drugs side by side. Very important, and isolation, okay?